Hi, everybody. My name is Megan, and for my topic, I want to focus on food insecurity. What is food insecurity? Food insecurity is a household level economic and social condition of limited access to food, while hunger is an individual level physiological condition that may result from food insecurity. So basically, food insecurity is a global issue that stems down to a social issue, then goes to economic, and then physiological. So it affects every aspect of being in society. Who is affected by food insecurity? Those who are affected often come from low income families. They live in rural areas. They're the minority group, people of color, people with disabilities and chronic conditions, and ones who come from poverty, which is the causes of poverty is low wages and unemployment, lack of affordable housing, racism and discrimination, and lack of education and healthcare. The next slide, we see a continuation of who is affected by food insecurity. So when it comes to the low income families, families that make less than $30,000 a year are considered low income. So for that matter, they are not able to afford food, especially nutrient rich foods. People who live in rural areas do not have access to fresh food and large supermarkets, so they mainly rely on fast food and gas station food, which we all know that is the most unhealthiest food there is. People of color and the minority group. Any race can face food insecurity, but the minority group face discrimination and racial disparities. Also, people with disabilities and chronic conditions face food insecurity because sometimes they can't work. They can't go to work because of their disability and condition. They also face much discrimination in the workforce, as well as the cost of healthcare. So if they already have health concerns, they have to spend all their money on their health care, leaving very little money to eat. People without education in healthcare may have a difficult time finding and keeping good jobs. This can often keep people stuck in low wage work. So this one was intriguing to me, which I never thought about. Without proper education and proper healthcare, that can lead to food food insecurity because you're not able to keep a good job, make a good wage, as well as if you have bad health care, you have to pay for health care. So the lack of affordable housing is causing an increase in homelessness and living in crowded conditions and unsafe conditions. So since we're not able to afford housing anymore because prices are skyrocketing, that's causing an increase in homelessness and everybody living in much crowded conditions and unsafe conditions as well. So the impact that food insecurity has on an individual person, an individual client, it would be that they would go without nutritious food, experiencing food insecurity. They would experience malnourishment. They would experience nutrient deficiency, which can lead to diabetes, lead to diseases such as diabetes and heart disease. It can also be impacted by physical health because malnourishment can occur, nutrient deficiency can occur. They can also be impacted with mental health. So, food insecurity has been associated with depression, anxiety, and low self esteem in both adults and children. Food insecurity can also affect lifetime earnings and the quality of a life in an individual's later years. So, the impact on society as a whole that food insecurity plays is food deserts. When people live in food deserts, they have very limited access to nutritious foods or any food at all, so they live off of what is nearby. When children are unable to eat their meals and snacks or nutritious foods for that matter, this can cause them to not be fully present in school. It can make them fail tests, become uncooperative, fall asleep in class. not being able to get the best education they should be getting. It can cause them to act out. Just, when you're trying to focus and go to school for 8 hours while you're hungry, it's kind of hard to focus on the curriculum and the lesson when your stomach is hurting from hunger. So this one interested me. I didn't know that there were this many food deserts in America. So the southern states are mostly affected due to poverty, which would be North Carolina, Alabama, Louisiana. In North Carolina, 1.5 million people are affected by this. And according to National Department of Agriculture, I believe it says 25 to 30 million Americans live in food deserts. That is a lot of food deserts. So every county in Alabama has one neighborhood with limited access to fresh foods. That affects 1.8 million people. And if I'm not mistaken, Alabama isn't exactly a huge state. So that was really heartbreaking to learn. So what can we be done? What can be done? How can we initiate change so that everybody gets to eat? Well, we can start with income support programs, community-based initiatives, policy changes, education, and awareness. And here we are going to continue on what can be done. So when it comes to implementing income support programs, such as social welfare, starting minimum wage policies, and unemployment benefits can help alleviate poverty and improve access to food. We can do also community-based initiatives, food banks, community gardens, farmers markets. This can help provide like right away immediate support to an individual and communities facing food insecurity. I really like the idea about the community gardens. That one was very interesting. I think every neighborhood should have a community garden. These initiatives also promote community engagement and empowerment. Another thing that can be done, policy changes. Definitely policy changes at the local, national, and international levels are crucial, very crucial, for addressing and changing the problem we're facing with food insecurity. This would include implementing regulations that promote affordable, nutritious food options. Because I always notice, why are the healthiest foods more expensive than the unhealthy foods? So it's like if I can afford to eat, it's going to be, the least healthiest amount of food. And addressing systematic inequalities. Education and awareness campaigns can also play a huge role in combating food insecurity. By promoting knowledge about nutrition, budgeting, and food preparation, people can make informed choices and maximize their resources. Yeah, I might need a little help on budgeting part. This is my work citation page. I used Feeding America. I used health.gov, as well as understanding the sociology of food insecurity. Thank you, everybody. And I hope that this problem will be resolved and nobody should have to go hungry. Nobody should. No child should go to bed without dinner. No person should go to work and not be able to afford themselves food. I hope that this can really, really be something that changes in the near future.